Now we're going to use double XL on the gonion. I will start with the left side. So to define the jawline, especially the angle of the mandible, we call it the gonion. We have to use Steel Edge double XL. It's the strongest product and we have more cohesivity on the Steel Edge range. So the trick is to put the two fingers around the gonion, so you feel the bone, and then you go right on the gonion. Now I feel the bone. Ça va? C'est pas trop douloureux?
No,
not so painful? Okay.
No, it's not.
When you are on the gonion, not on the masseter, but really at the bone, there you start to inject. You create a pyramid to project laterally and vertically the gonion. There is no risk here because the parotid gland is higher. The facial artery is really at 6 centimeters from here in the front of the masseter. And the duct of the parotid gland is really higher at 4 centimeters. Okay. Of course, the carotid artery is that deep, 5 centimeters. So when you inject the gonion, then you can also use the same entry point and create a bit more projection on the horizontal branch of the mandible, right? And same entry point, I like to use a vertical injection. Voilà, tac. And you see I do all this with a needle. Of course you can do with a cannula, but I like to create that shape, so you don't need a long cannula to do that. Okay. So you see the projection of this. I want to feather a little bit the end of my triangle horizontally and vertically. Voila, not bad. You can compare this side to the other side. Voila. Okay, with just one syringe, 1 ml of XL. Now we go for the other side. Okay, so on the other side, on the right side, you see there is a danger here. It's an angioma. So of course we're gonna avoid that angioma. Again, you put your fingers around the gonion and 0.5 centimeter from the angle you go on the bone. Right? And then you inject to create a pyramid, a bolus or a pyramid. So it's slow injection, so it's not that painful, and you see what is going on with your product, right? You have to be careful with this angioma, so I'm going to use a deep injection along the mandible. Here I'm subdermal, I'm really deep, probably into the fat here. And then I use the same entry point, and I use a vertical injection to create the horizontal branch, a new horizontal branch more defined. Voilà. C'est bien. Okay, and you see the shadow, now we have more shadow thanks to this convexity and this projection. Okay, alors de face, ouais, c'est bien. So now we have a more masculine jawline and chin.